دكتورة هتستخدم الماي ولا اخليه بعيد واعلى الصوت؟
لا لا طبعا. Human exposure. Regarding me, I already started with the biological exposure, you remember, and we discussed in general. So, inshallah, during our lecture, at least we will give you 2 examples for each exposure. So for that reason, we are going to give you some example about the biological exposure. This will be anthrax, inshallah, flu fever, different mode of transmission. Okay. ما أكيد كلكم سامعين what's anthrax. Okay. Anthrax أو سابقا يسموه wool sorter disease اللي يشتغلون بالحياكة الوول، أو rag sorter disease نفس الشيء. وله أسماء أو malignant posture الجبرة الخبيثة يسموه إذا تذكرون يسموها بالعربي. So many أو multi charbol لأنه هون. Okay. So it is a serious bacterial and respiratory as well as it is gastrointestinal disease. Serious bacterial diseases, zoonotic disease بالأصل هي ولا zoonotic diseases that affect gastrointestinal, just I told you, and also respiratory system. It is very serious. It is quarantinable disease, one of the quarantinable diseases. Mostly affect all the mammal, including طبعا the human and some part or some species of the birds also, بعض الطيور. And herbivorous. شو herbivorous؟ carnivorous. So it affects the herbivorous and carnivorous أكثر شيء يكون very aggressive. Okay. In a plant-eating animal, infection occurs when they eat or breathe out the spore. So it is a spore or bacteria. When okay, they breathe it or they eat it. So that's why it's gastrointestinal and respiratory. And the carnivorous may become infected when they eat the infected animal, the herbivorous. So this is the, in general. Herbivores are often infected while grazing. طبعا plant eating animal infection occur when eat or breathe, just now we mentioned it, breath in a spore. So when they eat the spore or breath just the spore while especially when eat spiky vegetation. لما تكون الفيجيتيشن سبايكي طبعا راح تدخل مع التأويل هذه راح تجرح. Okay, in this case the spore will live in. Okay, so that's why when they eat spiky vegetation, the vegetation has been hypothesized to cause wound inside the intestine within that tract or GI tract. Okay, then the bacteria will be there, so it has vegetation and growing of the bacteria will occur. Carnivores, as we mentioned, they become infected when they eat the infected animal. يعني اللحوم تبع infected meat or meat of infected animal. Once ingested or placed in open wound, the bacteria become to multiply just now. من تدخل أول vegetation إلى بعدين تتحول. It will be multiplied inside the animal or human, of course. And typically kill the host within a few days. That's why it is very serious. That's why it is used by terrorists. للممكن بكتيريا ممكن هو حاليا يمكن تسمعون اللي بيصير. The spore germinate at a site of entry into a tissue and then spread to the circulation. أول ما يروح للليمف نود يروح بعدين يروح للبدن. Of course, infection caused by the Bacillus anthracis. It is a bacilli, it's gram positive, ما أريد أمشي وياكم كثير وياها. In general, an infected human is, just now I told you, it is quarantinable disease. It is quarantinable disease, but it does not spread from man to man. It does not spread from man to man. Why it is quarantinable if it does not spread from me to you? Why? Because, yes, because the spore may be on my cloth, so he will breathe it. That's why it is quarantinable disease. It's not transmitted from man to man. So Bacillus is gram-positive. It is a spore forming. It is discovered by Robert Koch in 1867. طبعا هو أخذ sample من الكتل and he detected the bacteria in sample. ما نريد نروح in detail بيها بس أنه تعرفون أنه it had been discovered by Robert Koch and it is gram-positive. So what's the harmful effect of this bacilli? It has two sides of it. Local effect and systemic effect. Locally with the skin, so it causing when it enters the skin, especially when there is a wound or something like or scratching the wound, so the spore will enter in that area. And this is the picture. Okay. This is the picture of the wound. So at a site of entry, vesicle will develop, but at the beginning as a vesicle, but then it will progress to deep black issue. That's why it's named as black issue. So deep black, and the most characteristic of this skin lesion, it is painless. It is painless حتى perform in other skin disease, any other types of. So it is painless. Systematic. The disease will spread from local area, either from the skin through nodes, as I told you, to the regional lymph node, and then to the bloodstream. This is one way, which may result in overwhelming septicemia and death. This is one from the skin, or just now we said from respiratory, or by inhalation of the anthrax spore, and causing initial symptom that mild and أول مرة mild and then non-specific, but then have two stages we will discuss later on when it affects the lung system. Okay, so at the beginning it gives a sign or symptom as any simple upper respiratory tract infection. That's why the diagnosis of it is overlooked. Okay. Respiratory disease, fever, shock, and then within 3 to 4 days is the fever or shock, and within 7 to 24 hours, death will occur. Right? That's why it's very, very, very serious. By the way, these أرقام أنتوا دائما تسألوني نحفظ الأرقام. Yes, this is. Exposure, actually this anthrax spore, it can survive in the environment for decades or even centuries. عشرات or مئات السنين تبقى. That's why it is very, very dangerous, and that it can resist all the environment, harsh environment. That's why they use it in the as a weapon, okay? Used by the terrorists. Okay, so it can survive, able to survive in a harsh condition for decades or even centuries. مئات السنين تبقى. Okay. So occupation who are at risk exposed to infected animal, definitely because it is genetic disease, or exposed to the product of infected animal, they are at risk of having anthrax. Worker who are exposed to the dead animal وأنا ما بعرف ليش مات الأنيمال, maybe due to the anthrax. Then if I exposed to this dead animal, maybe I will get anthrax from the fluid, any fluid coming out from the dead animal from any normal opening. Okay? Contaminated fluid that come from the body of this animal. Dead animal or animal product or are at a high risk, just now we mentioned, especially in the country where anthrax is more common. Anthrax in a livestock grazing in an open range. What do you mean by open range? الحظيرة مفتوحة ويأكلون. يصير mixing between wild animal and the other animal اللي قلناها قبل شوية, الهربيك virus and carnivorous, فيصير mixing. In this case, both of them will be affected. In open range, where with the mixed wild animal, still occasionally occur, is more common. With still occasionally occur, this is in United States. Handling infected animal, their wool and hides. ولهذا wool sort of disease. Handling infected product of any infected. Many workers who deal with the wool or animal just now, or hides. What's hides? What's hides? Hides. Hides, animal, are routinely exposed to the low level. Actually, they are exposed to the low level, but they will not get infection. Why they get infection? When the number of spores in the infected animal or any product of animal, wool or any other things, ranging between 10,000 to 20,000 spores. Less than 10,000, there is no infection occur. Okay. However, so many studies done, there is no exact average limit for the dose of infection. Okay. But so many of them, they see it, the lethal infection is 10,000 to 20,000 spore. In this case, this is the dose, lethal dose of spore-forming disease. Okay, you can see this picture. Those holding the head of the animal on their neck, شايل على الكتف. ولهذا it is in the picture. And in any other wool sorter, يحط ايد على ايده. يحط على ايده الاشياء. That's why. Animal occupation occur in animal breeder اللي يربون الانيمال, animal caretaker, definitely, animal scientist, butcher, farmer, and many other, and rancher, كلهم دولة, farmer work, كلهم دولة, handling the animal or animal product you can see over there. Okay, so they will get the disease. Handling of infected animal, carcasses يعني الميتة الجثث. Okay, or placenta يحطها على ايده او على رقبته على any other, so he will get the disease. Handling of raw goat hair لانه مليانة spore, or wool or hides from the endemic area. All these, or veterinarian, those are people who are at risk of getting anthrax. Risk factor, of course, هي نفسها. People include worker in animal or animal product, or already we mentioned it. A traveler to the endemic area, an area where there is a high prevalence. Postal worker. ليش يجاب البوستال وركر اللي يشتغلون بالبريد؟
مسافة ما تنتقل أماكن كثير ممكن تجيبوا.
شو جاب البوستال؟
تجيب كثير اشياء او انيمالز مثلا.
ما بعرف سامعين كم قصة انه جانا بريد وفتحها ومات. فالبوستال وركر اللي يعني البريد اللي يجي هسه قبل شوي ان التيرورست يستعملوه. That's why. فهمتوا؟ deliberately يعني deliberately متعمد. Okay, postal worker, military personnel. وهي هذه اللي هسه اللي تسمعون بالأخبار. Contact of laboratory طبعا اللي بالlaboratory accident. It has also been used as a biological warfare. السلاح by the terrorists. Now, mode of infection, as just now we said, first of all, we said gastrointestinal. طبعا هو أكثر شيء skin. Gastrointestinal or through inhalation, يعني ingestion, inhalation, and cutaneous contamination for the skin. Okay. الأكثر شيء cutaneous infection, this is also known as a hide porter disease. hide يعني porter ولهذا على الإيد مثل ما قلنا قبل شوية على الرقبة وعلى الإيد. hide porter disease or carrier porter. It is the most common form. It is more than 90% of the cutaneous, more than 90% of the anthrax is a cutaneous anthrax. Okay, and it is low mortality rate نسبة للبقية. It is also least dangerous, again dangerous than the other. ما بيموت كثير زي البقية. Low mortality rate. Cutaneous anthrax is typically caused by, طبعا of course by Bacillus anthracis spore, enter through cut skin, just now we mentioned, or any wound or scratching of the skin. This form is mostly found when human handling the infected animal or animal product the same. Let us see the mortality rate of this. Cutaneous anthrax is rarely fatal. It is 20%. Mortality rate معناتها 20% without treatment. Okay, we will see to compare it with the other type. It's very hard. Okay, without treatment, 20%. With the treatment, most probably it will be good. Okay. It may progress to toxemia and death if not treated. طبعا. That's why it is 20%. As we mentioned just a few minutes ago, it began as an irritant, okay? Then itching, boil like fistula, skin lesion, then eventually form ulcer, deep ulcer, a black center. This is the characteristic. Deep black ulcer العفو. Okay, that's why they call it issue. The black issue often show up to a large وراها edema surrounded by edema. Edema could be moderate or mild. We said just a few minutes ago, this black issue is painless. This is the characteristic from the other skin lesion. It's necrotic ulcer, but it is painless. There is a form of edema, and then in general cutaneous infection form within the site of the spore, طبعا entering between 2 to 5 days after entrance of the spore inside the skin. 2 to 5 days, this all skin lesion will appear as irritating, itching, and then ulcer, and then boil, and then ulcer, and so on. Unlike bruises or the most other lesion, we said it is painless. It causes no pain, already we mentioned. Then the nearby lymph node will enlarge. The lymph node near this side will be enlarged. The lymph node is painful. Enlarged lymph node is painful. Okay. ما بعرف موجودة بس هي anyhow هي painful. So it is enlarged, swollen, and then it will painful. Complete recovery may take longer time if untreated, but it may change as we mentioned. It causes septicemia and other, and maybe few weeks causing death. Coming to the respiratory, of course. Previously, they call it inhalational anthrax, also called wool sorter. Wool sorter diseases because by inhalation, the spore, because it was occupational hazard for people who sorted the wool. This form of infection is very rare currently. Okay, relatively, it is a rare disease. It is presented in a 2-stage, as just now as I mentioned. There is 2 stages of these diseases. At the beginning, at the first infection, the lymph node in the chest will be first be enlarged, infected. So the disease affects the lymph node. The lymph node in the first will be affected rather than the lung, then causing hemorrhagic mediastinitis, and in this case it causes shortness of death. لا مش هذا بس هذا البوينتر مثلا. Okay. The first stage, as we mentioned, just give a sign and symptom of upper respiratory tract infection as a flu, as a simple respiratory tract infection. So flu-like symptom, fever, and cough, and shortness of breath, cough, fatigue, and chills. And this will last for hours or days. But then within short period, it will become very serious. Fatality of inhalation or respiratory, it's more than 90%. Mortality rate is more than 90% in the respiratory anthrax. We said the first stage, that's why, because the first stage is mistaken from, similar to the upper respiratory tract infection, so the diagnosis will be mistaken. In this case, the patient or even the doctor will not take care of him. So it will be undiagnosed. The first stage is mistaken as a cold or flu. Okay. Then he will pass to the second stage. If the second stage occurs within the infection will spread from the lymph node to the lung. So the first stage still the lymph node, but the second it will spread to the lung itself. Symptom of second stage develop suddenly. Within very short period of time, the second stage will start it within days or within hours or days even. Symptoms include high fever, shortness of breath, extreme shortness, shock, and death will occur within 48 hours. So that's why it's very dangerous. Mortality rate, we said just now, more than 85, just now we said more than 90 even. So, distinguish pulmonary anthrax from more common cause is very, very important because it is certainly will develop into a very serious, into a very fatal cases. So we have to diagnose it even in the first stage. We should diagnose. It's essential to diagnosis to avoid delayed diagnosis and delayed treatment because it's treatable disease, by the way. The infection of herbivorous or even the human by inhalation route normally proceed to once spore, how it occurs, once the spore enter or inhaled by the feline or by the human, they will transported into alveoli. Then the spore are within them picked up by macrophage in the lung and transported through the lymphatic system to the lymph node and تروح midstream blood midstream. Once in the lymph node, the spore will germinate. تطلع من the spore will germinate and multiply, of course, and active bacilli will multiply, and then the macrophage will burst. When it will burst, then it will disseminate all these bacilli to the lung and then to the other body and release many bacilli into bloodstream and in this case to the entire body, and then this will cause septicemia and then death of the patient from this case. Coming to the gestational, it will be infection is a must, often caused by consuming anthrax infected meat, where the wild animal occur. Consuming anthrax infected meat, and it is characterized by diarrhea with bloody diarrhea, abdominal pain, loss of appetite, and then occasionally vomiting and blood with the blood. The lesion occur usually in the larynx, in the intestine, in the larynx, in the throat, and in the mouth. After bacteria invade the gastrointestinal system, it will spread to the bloodstream, just like that one, and then to all over the body, throughout the body, and it make a toxin. So gastrointestinal infection can be treated. Of course, it is a treatable disease, but usually result in a fatal rate from 27 to 75, depending to 75, 25 to 27, depending on the diagnosis, how long, the earlier the diagnosis and the earlier the treatment. Of course, it will depend on the treatment and diagnosis. Also, this form is rare again and again. The most common is the cutaneous anthrax. Now, another form, we have injection. By injection, it is very, very rare when the injection or the syringe is contaminated, so it will causing anthrax to the body. Diagnosis, of course, you are going to identify the bacilli, gram-stain bacilli, And also there is another way to diagnose antibody or the toxin in the blood. You can diagnose it. And nowadays, of course, there is using of PCR and also by culturing. The gold standard for diagnosis of anthrax is by culturing the organism to detect it. Now, of course, so when, depending on the type of the disease, whether cutaneous or respiratory or gastrointestinal, you are going to take the specimen. For the cutaneous, we have to take a sample. We have to take, okay, some small sample from affected, or from the chest. You have to do chest X-ray or CT scan. Of course, for gastrointestinal, you are going to take the stool, and also in some case for meningitis, you have to do the CSF test. All these depending on the type of the anthrax you have, so the clinical material you will choose depending upon. Okay. Epidemiology, it is spread, as we mentioned, anthrax is spread by contact with the bacterium spore, which often appear in the infected animal and animal product. Contact is by breathing, eating, already mentioned, okay, or by broken skin, already. This is again for epidemiology revision. It is, although it's a rare disease, but it's very, very serious disease. It is most commonly occur in Africa and Central and South Asia. It also occurs in South Europe, by breeding animal. It is uncommon in North Europe and North America. Globally, at least 2,000 cases occur per year, all over the world. 2,000 cases. In America, about 2 cases a year will occur in America. Galil College. بالعالم 2000. Okay. Until 20th century, the anthrax, because of the diagnosis or overlooked the diagnosis, so until 20th century, there is a lot of persons who have been killed as a result of anthrax. Killed hundreds or thousands of people because of they are overlooked for the diseases. Skin infection represent the most common, we say, more than 20%. Without treatment, death mortality is 20. Intestinal infection risk 20 to 27 mortality, while the respiratory is more than to 85, it is even more than 90% the mortality rate. Okay, it is developed as a weapon, just now we mentioned. Prevention and control. So, it is quarantinable disease, and it is very, very serious disease. It is used as a weapon, biological weapon, used by terrorists. So there is so many prevention and control. First of all, this is very important. Certification of importing hide, hair and wool as anthrax free. فإذا أي شيء ما يدخل البلد whether animal or hair or any other things, okay, or wool, unless there is a certificate saying it is anthrax free. Okay, this is all over the world. Okay, by exporting country, of course, has reducing the incidence of. Moreover, in UK, the imported hair and wool are treated with warm formaldehyde. حتى لو في certificate also they treat it with the formaldehyde. Moreover, in the United States, what they do for prevention and disease, the chief prevention measure we have for a high-risk industry worker is immunization. كل هذول الميديترينيان والأذر اللي at high risk اللي just now we mentioned it, they will give him immunization, we will mention. Improve personal hygiene definitely of the worker. Okay. Protective clothes اللي كل الأشياء اللي we mentioned it in the previous lecture about the prevention of the biological hazard. We have to use it here. Protective clothes, ventilation and house control plan, vaccination of animal in zoonotic area. We have to vaccinate. So here vaccination for animal and also vaccination for human. We have strict adherence to the law regarding animal contract or died. Okay. Strict. كل law we have to follow it in strict or died of the anthrax have helped to reduce the agricultural incidents. Precautions are taken to avoid contact with the skin or any animal product or fluid, just now we mentioned, or fluid exudated through natural body opening from the deceased body. Okay. This is very important. Just now we mentioned a few minutes ago. Now, the body should be put in, deceased body of animals should be put in bag, okay, in strict quarantine. The blood sample is collected and sealed completely and analyzed in approved laboratory. مش كل laboratory لازم in approved laboratory مشان النتيجة تكون to ascertain if anthrax is a cause of death or not. This is very important. The body should be sealed in an airtight body bag and incinerated تحرق to prevent transmission of anthrax. Full isolation of the body is important to prevent possible contamination. Protective impermeable clothes, already we mentioned it, impermeable, ما بيطلع منها مية. Impermeable clothes or كل equipment تبع protective equipment, personal protective, should be very good, protective and impermeable. Okay, all these should be. Disposable PPE is referable. Okay, all contaminated bodies or clothes is isolated and should be put in a double plastic bag, and then we have to write on it a dangerous or risky or any other word, a dangerous or biohazard, as we mentioned. All these, the PPE should be should be used in a proper way and should be used in the best quality, I mean. Preventive antibiotics are recommended when there is a case of suspicion. For those who have exposed to the infected animal. Early detection of source of anthrax should be done in order to prevent more contamination. Person clothes and body may be contaminated with the spore, just now we mentioned. So effective decontamination of people can be accomplished through washing down with the antimicrobial and washing by soap and water and then antimicrobial detergent. Water is treated with the bleach. Waste water should be treated with the bleach or any other antimicrobial agent. Effective decontamination of the article can be accomplished by boiling them for 30 minutes or longer. Chlorine bleach is ineffective in destroying the spore. So in this case, it's much better to use formaldehyde. It's effective for killing them. Burning the clothes, burning everything effective material is much better to prevent the transmission or to destroy the spore. Antibiotics, so many, it is treatable to so many antibiotics. To doxycycline, erythromycin, penicillin, all these are effective antibiotic for treating the anthrax. And also we can give antibiotic prophylactic treatment for those who were suspected to be exposed to the anthrax. Okay, treated to prevent possible death. Now coming to the vaccine, one possible approach to vaccinated animal is initial schedule for we give them 2 doses, 1 month apart, and then single annual booster dose. This is for animal. We said vaccine for animal and also vaccine for a human. For animal, we give him 2 doses, 1 month apart, and then a booster dose. This is regarding animal. Regarding the human, we give him 5 doses. This is before exposure. We give him 5 doses. Okay. This 5 doses should be given for a period over 18 months. And then we will give him a booster dose every year. And of course, you know, this dose is given to those who are at risk of exposure to anthrax during their work. This is regarding pre-exposure. And post-exposure, after the person had been exposed, according to the FDA in 2015, they recommended to give a vaccine, okay, but in 3 doses. In 3 doses, of course, with the vaccine, we have to give antibiotic in 3 doses over 4 weeks. And of course, we will give him 60-day course of antibiotic. This is for post-exposure, give both antibiotic as well as 3 doses of vaccine. While in pre-exposure, we will give them 5 doses of vaccine, and then of course a booster dose, annually booster dose. Of course, this is people who handle animal or animal product, or those who are veterinarian, or there's military state, all those will be treated in this way. Thank you very much. I hope it will be okay for you. الخميس إن شاء الله يجيكم دكتور أشرف يعطيكم المحاضرة. Again,